So our orthodontic practice is unique because we've been here a long time. My dad started this practice in the early 60s, so we've been around almost 60 years. I got to grow up watching that happen and how he and his partners treated their patients. And we've tried to follow in their footsteps, trying to make it a family-run place where it's comfortable for kids and adults to be here and a friendly environment. We want to make sure that everybody's taken care of properly like we would take care of our own family.
We're personalized. We're owned here locally. We're not a corporate store. Everybody that's here is local. This practice has been here for a long time.
We're actually treating the grandkids of some of our patients from years ago.
And our service is beyond a doubt the best in the state of Virginia.
There's 3 doctors here at Sabol Visser, and we've been together for over 30 years. We work together as a team, working on treatment plans for all our patients, and so it brings in a lot of expertise and different viewpoints that we put into every treatment plan that we create.
So the doctors here have a lot of experience. We are all 30+ years in the business now. I'm the youngest, and we've got over 100 years of clinical experience between the 3 of us. So that's thousands and thousands of cases that we've seen together over the years. So we offer almost any orthodontic experience that you could want. We offer traditional braces in metal or clear, using Invisalign trays as well for clear aligner therapy, TMJ therapy, pretty much anything that has to do with moving teeth or getting your bite right or your smile right, we're there.
We do that first by information and educating the patients, letting them know what to expect and taking away a lot of the fear and anxiety that patients come to the practice with.
So we always try to strive for our patients to have the most comfortable experience they can have in orthodontics. Using modern technology is a great way to do that. With a lot of our wires, we'll start with a very light wire, which creates just very minimal force on the teeth and the patients so they can get used to their appliances without having a lot of stress in the initial days that they have their appliances placed.
There's never been a complaint about discomfort. The 3 of us always go to meetings to make sure that we're up to date on the newest technology.
Lots of new things have come down the line orthodontically, and we watch and look over everything as they come through, making sure that we're taking advantage of all the new things that can come out to make our patients more comfortable and have a more efficient treatment and a better result. Over the years, we've gone from traditional braces with bands on every tooth to bracketing pretty much every tooth, which is much more comfortable for the patients. We do a lot of light wires, which creates low forces on the patient's teeth.
It actually moves the teeth faster than we were able to do so 25 years ago.
Here at Dr. Sabol Visser, we use a team approach. So there's 3 doctors with a tremendous amount of experience between the 3 of us, and so we look at every case together. Each case is looked at by 3 individual doctors, and we each give our opinion as to what direction to go.
At Sabol Visser, we have one of the best staff in the state. They're awesome. They'll come up and take a patient that's really scared and calm things down. It's really a group effort here. It's not just about the doctors. It's more about the staff. The doctors are here directing things that are going on and treatment planning and making sure that the smile and everything looks good, but our staff is awesome.
When they walk in the door, they're going to get greeted with a friendly face, and they're going to make not only the parent but the child comfortable being in the office.
Consultations in our offices are very easy. We're going to collect some diagnostic information, which are simply just x-rays and photographs.
Electronic scan allows us to produce a simulation of what the treatment is going to look like. So they could walk out literally with a video of what it's going to look like.
And that allows us to better educate the patient.
Because a lot of times dentistry can be scary, especially for younger kids, even for adults that have bad experiences. So we're very much want our patients to be comfortable in the chair, being able to communicate with us and tell us what they're feeling and what they're seeing. Initial visits, you're going to come in, we're going to take some initial records, and we'll talk to you about what you think is your problem. What do you want to get fixed? And make sure that we're following through on that and make sure your chief complaint is getting fixed. At the same time, we'll be looking for problems that we're trained to fix and tell you how that happens. During each visit that a patient comes back, we're checking to make sure the progress is going in the fashion that we want it to be. To make sure that they're getting treated on time in a timely fashion and they're going to finish when we expect them to finish. So we're going to watch that and make sure they're doing that. We're going to motivate them to get the job done because they want this end result just like we do.
The difference with us is we're privately or family owned, if you will. We don't belong to a corporation, so we're making the decisions here in the practice that are best for the family and the patients. We're not being influenced by outside factors.
We feel that our practice is unique in Virginia Beach and in the Tidewater area because we've built it over the last 60 years. We've been family owned since the beginning. My father started the practice in the 1960s, and we've carried on that tradition of treating people like their family. It's very important to us for people to be comfortable, and in order to do that and get them the results that they want, we are going to treat them with the most up-to-date, most modern technology available, including 3D printers and 3D scanners, all the things that you need to make practice easy on patients, trying to minimize having to take impressions and things that kids just don't like to do.
First, with emergencies, we are, as a privately owned, family-owned business, we are always available. We give you our personal cell phone numbers, and you're able to reach out to us after hours on the weekends, and we'll meet you here at the office to take care of that.
They leave a message, we'll call them right away, and I've met people here at the office to fix problems on the weekend, Saturday night at 11:30 at night.
We'll also talk you through the problem and show you how to solve problems yourself in case we can do that and save you a trip to the office.